Kathy, why are my hands going all veiny and wrinkly? What's going on?
Well, as you get older, obviously you lose subcutaneous tissue, you lose connective tissue, collagen, elastin. The skin gets thinner, and that's from aging. It's from the sun. They're the two main reasons, and genetics. I mean, it's often you can look at your mother and have a look at her hands and see what's going to happen. The way you look after them, has a lot to do with how they appear.
So when you do hand rejuvenation treatments, is there a way or is there any evidence that you can stimulate the collagen and other tissues to grow? Or is it just really just, cosmetic in a sense, or moisturising? Well, there's short-term benefits.
Well, I mean, there's nothing that you can do that's permanent, and you always need ongoing attention, because as you age and as you get exposed to the sun, more degradation happens. So, I mean, there's a few things that you can do to prevent that happening, and or to slow down some of those things happening. I mean, one is using sunscreen. That's a very important thing. It's sort of number one on the list of skincare, and you can use various topical creams that do help stimulate, improve cell turnover, that can decrease pigment.
Do you use anything? What do you use on your hands?
I use a topical vitamin A.
Okay, which one?
I use Retrieve.
Right, who makes that?
I'm not sure. I just
Oh, that's right. Yeah, it's Retrieve. Okay.
Retrieve. It's a commercial product.
Right. Okay.
Why
you selected that? Is that to do with
prescription
for
that?
Oh, that's a retinol.
Yes, it's 0.05.
Oh, okay. You've got to write a script for that.
Yes. Yeah. And also I also use a topical AHA on my skin. So that's
okay. Who do you use?
It's an all-medic product.
Right. And why did you select that one?
It's 15%.
Glycolic,
and so it's quite effective in getting rid of the dead skin cells and keeping the skin fresh, and then I apply the topical vitamin A, and that's what I do on my face too, so it's just a matter of remembering to do it on your hands as well.
Right, okay. So we've just gone through the PRP and we're using a filler here. Are there fillers that you should avoid, do you think, on your hands?
Well, you do need to choose the right filler.
Right.
There are fillers that probably have the wrong properties for the hands.
Right. And give me a rundown, will you? Because I think this is an area that people don't understand. They're not going to their practitioner and saying, "What filler do you use for my hands?" And how would they know? Like me, I had the wrong filler in my hand.
Yes.
So I've ended up with gnarly hands as a result. So how do you avoid that?
I think that, a filler that stimulates collagen has the possible outcome of producing lumps or granulomas in the skin. So I personally don't use those fillers that stimulate collagen. I tend to use just hyaluronic acid fillers. But other fillers that you can successfully use, Radius is another one. Again, I don't use that. It's not my first choice, but for a lot of doctors it is, and there's a lot of evidence that works quite well. But you wouldn't use a volumizing, a very volumizing filler in the hand, or something that's very firm. The hand is very forgiving though. You can, the skin is loose, and it's easy to, whatever you inject, you can spread it around very easily. So it's you can actually use a lot of different types of fillers and a lot of different strengths of fillers to a point.
Right. Okay. So in terms of pain relief, you use a topical anaesthetic.
Yes.
And that's usually enough, isn't it?
That's all. Yes. Yeah. As I said, it's really quite a simple process. What we're going to do is, after we remove the anaesthetic, we'll clean the skin. And I just inject the filler in small little blebs around the worst affected areas.
What's a bleb?
It's like a little bolus of the filler, which is like a gel. And then when we're finished, I basically just massage the hand very well, and it will disperse very evenly over the skin, under the skin. So it's only a few, maybe 10 or so little injection points.
Okay.
So it's really not a very painful thing, particularly if we've got local anaesthetic on first. A lot of people don't choose the local anaesthetic, and yeah, that's certainly quite doable as well. It's not very painful.
And how much do you put in to each hand?
I usually put a mil on each side, but there will be some people that I will ask to come back and need to put another mil on each side, depending on the state of their hands and how much.
Is that age related? Like, or is it the size of the hands?
Well,
or damage?
It can be age related, but it's also body fat. You know, if you don't have a lot of body fat anywhere else, you're not going to have a lot of body fat on your hands, probably.
Yeah. Right.
So if people have lost a lot of weight or are particularly thin, then they're more likely to have hands that show the veins, that show the tendons, and have wrinkling.
Yeah. And how long does this last for?
Probably about 12 months with the filler.
Right. Okay.
So it's something that may be better to review every 12 months.
Annual thing.
Yeah.
And indicative cost? What's the cost, for something like this?
For 2 hands, using 2 mils, with the product that I'm going to use today, it would be $1,400.
Right. So it's an annual spend of $1,400. You just factor that in with all the other body parts as they deteriorate.
Mm-hmm.
So. Anyway, I think that's about it. What are the side effects? Oh yeah. So what do I do? Do I have to do anything special?
There really isn't a lot of particular aftercare. Yeah. I mean, if there could be a little bruise, that's a possibility, and you can ice the area afterwards, and that will help reduce the bruising. Yeah. And if there is a little bit of swelling, and there will be a little bit of swelling, but it's not severe. Yeah. But ice, you're careful not to overheat the tissues for about 24 to 48 hours, because then you're more likely to get bruising and swelling. Okay. So normal skin care, but nothing active on the skin to start with. So no topical vitamin A or glycolic on the skin, just using a simple cleanser, a simple moisturiser initially, for a couple of days. And those tiny little injection points will have healed. Yeah.
So if you're going to do the surface rejuvenation, you do all your IPL or laser before, because you don't want to be zapping into the...
That is the ideal situation.
Yeah, so
ideally, if somebody has an issue with aging hands, it's a staged procedure. You can't do everything at once. Yeah. And the ideal situation would be to do a course of IPL first. If there's a lot of people...
How many treatments of IPL?
We generally recommend 5.
Right.
Yeah. It does depend on the state of the hands, but that's a general recommendation. We find to get the best results, 5 treatments. So we do that
IPL
first.
And then PRP. Would you do it at the same time, or do you do that later?
You can do PRP either before or after the filler. I wouldn't do it on the same day.
Right.
But you could certainly do it before the treatment, or you could do it after the treatment. The way that we use the PRP is once we produce the PRP, then we actually use a dermal, which is a needling device that has a chamber on the top, and we fill the chamber with the PRP solution along with some hyaluronic acid that allows lubrication, and that moves over the skin, injecting the needles as the dermal goes in and out of the skin. It injects the PRP into the precise depth, so we get the needling effect, and we know that needling increases collagen production, and we also have the PRP, which also stimulates collagen production. So the two together, it's a very good combination.
Right.
It is a course of treatments, though. We'd recommend at least 3 PRP.
Right. And what's the cost typically of a PRP treatment?
A single PRP is $700.
Right. Okay. So you're pretty committed. I mean, if you only had a budget of $5,000 a year, you'd chew it up with hands. I suppose it just depends on what you...
The thing is that you once you've gotten the level of rejuvenation that you want, it's then about maintenance. So the cost of maintenance is not going to be the same. Perhaps one treatment every 12 months, both the filler and the PRP, and a maintenance IPL would be a good way of maintaining the effect.
Oh, that's fantastic. Thank you so much.
That's
very informative.